Jambo, my name is Amos Karanja Jerry from Nairobi, Kenya. I have been living with a heart condition for a long time. If I can remember well, since I was in primary school. Any hospital I visit, no conclusion. But actually, the last doctor I visited at my home area recommended that I visit another physician. That's when I consulted from other friends who have come to India, and almost all of them, they recommended me to Apollo. The first week was about investigation. By the second week, wow, the doctor came to my bed and told me, he asked me a question. Have any person ever told you that you have a hole in your heart? Almost tears came rolled into my eyes, but not tears. I thought the doctor would think that tears of sadness and surprise, but they are tears of joy, because at last I knew what was ailing me for the last 35 years. I was so happy and overjoyed. Dr. YVC and his team started preparing for an operation. Operation was done, which lasted for 4.5 hours. 2 days, 3 days, I went in the ICU. The kind of the care and attention you are given there, wow, it is out of this world. After 3 days, I was in the mid ward. And after 4 days, I had my discharge. What else can I say about Apollo? They actually go in line with their mission and vision. That if you think about health managers, think about Apollo. I don't have words to thank my doctor, Dr. YVC, and his team. All I can say is that may God bless them. May God bless Apollo.
Amos is a pleasant teacher from Kenya. He had come over to us with a long-standing history of palpitation. He was diagnosed to be having a rare disease called ARVD, a really disappointing disease of the heart muscle, which has no good treatment. But fortunately for us, it was not that disease. It was a big surprise. He had a hole in the heart from birth called an ASD, but located in a very, very rare location and in such a way that it was not easily accessible to routine imaging modalities. But we were able to spot that, and then of course it's all very good, because once we identify that it is a disease which has an easy cure, then he gets surgery done for the hole, and then it is a clean recovery. And this is a disease which is curable. So once we have treated that, he is no more a patient. We can call him perfectly normal. He can live a normal life. So it was a surprise for Amos, a pleasant surprise, that he came with a diagnosis of a disease which was probably not curable, with a long problems and all that, but now he's a normal person. And when you went through the surgery will have some amount of pains, but you recovered quite fast. So how do you feel now?
I feel good. I feel energetic. I feel as if I've been given another lease of life.
So excellent. I think we hope more and more people will come to us and get treated and benefited in the way Amos has become healthier. Thank you, Amos.
Thank you
very much.